So good morning, everyone. It is an absolute pleasure to be here, and thank you so much to KER for the invitation, and to Dr. Pagan for encouraging me to keep changing airports and making it here. So I'm glad to be with you. So to start this off, I just wanted to kind of survey the room. So who here recommends vitamin E supplementation for any of their clients' horses? Okay. Who here routinely measures blood vitamin E before recommending vitamin E supplementation for any of their horses? Okay, good. We're going to change that by the end. I'm going to have like an equal distribution. So, and I'll hopefully explain to you why. So there were some great questions early on about why we would do this. So this is what I'd like to go through with you this morning. So the first is, why are we even talking about vitamin E and why is it important? We'll talk about how to collect samples and how to analyze these, and much to, I think, every equine veterinarian's dismay, Michigan State University has changed their methods, thereby changing their reference range. So we will talk about that and what to do. How to effectively supplement, I know that question already came up, so we'll go through that. And I am going to touch upon, is there an injectable product? Because I get asked this question a lot. Is there a risk to overdoing it? And we'll touch upon that as well. And then I would like to just close with some case examples that hopefully will get some owner participation, or I should say attendee participation in at this stage. So let's start with why vitamin E. So if we just look at videos of these two horses, so this gelding on the left has a normal serum vitamin E concentration if we're using this reference range of 2 to 6 micrograms per mil, which has been the reference range we've used forever. And it's quite healthy. And then this is actually a rescue horse here. Oh, you don't need to listen to me train vet students as I go through it, or maybe you do. So this is actually a fell pony stallion that came in, and he was, there we go. He was actually brought in because the owner said he's got severe weight loss and we just can't get weight on him. And the other thing is he's really, really badly behaved. He will never stand still. He just keeps walking. And it ended up that he had a very low vitamin E concentration. We diagnosed him with equine motor neuron disease. And as Dr. Valberg alluded to earlier, the muscles affected with these horses are those postural type 1 muscles. So it's very hard for these horses to stand still. So this horse is really much more comfortable either walking or laying down, but standing still is very difficult. So they'll either shift like they look like they have laminitis, or they'll walk like this. So this was actually part of this horse's disease. And then a more subtle example, so this is actually an Oldenburg gelding that had been imported to be a junior hunter. And this is the trainer on this horse. And he really just never had clean lead changes, ever. And this is one of the top riders. And the horse actually started tripping with the junior rider when landing over fences. And that's how it eventually came to me. But looking back at these videos, the trainer was saying to me, I could just never get both directions this horse to have clean changes. So there are these subtle things too. And this horse actually we did diagnose with equine neuroaxonal dystrophy. So the classic presentation for equine neuroaxonal dystrophy, or equine degenerative myeloencephalopathy, is a story that goes a little bit like this. So this was an owner that had bred actually two, her mare, she had collected embryos on from the same stallion. So these are two full siblings. The chestnut is the colt and the bay is the filly. This is them at 5 months of age in California, and she'd bred these to be her upper level dressage horses. I'm really glad she had these videos because the contrast is going to be pretty stark here when you see how they looked later, but you can see that colt doing tempi changes at 5 months of age. This is how they look when they came to us at Davis. So this is the colt, and now they'd been on a good nutritional plane other than they were not on pasture or receiving any supplemental vitamin E. And he looks pretty awful as far as overall condition, but he's quite ataxic, right? So the circles, he has a very hard time. He steps on himself. He's got this base-wide stance in front. Honestly, had it just been him and not the filly, who's a full sibling, I might have thought, well, maybe this is a wobbler, and that was still a differential for him. But when his full sibling also looks this bad, I start thinking more that this is more along the lines of equine neuroaxonal dystrophy, which is, as far as a genetic basis, has a lot stronger evidence for. So this filly was really spastic in the hind end and very hypermetric, and she loses her balance a lot. So both of these, the colt and the filly, were quite deficient. They actually had serum vitamin E's less than 1. They were raised in a dry lot in California with no access to pasture. And neck x-rays were normal. We did EPM test them, it was negative. The owner said, what can I do? And I said, well, let's try them on vitamin E. I've never had them resolve once they look like this. And we supplemented them for 6 months. We got their concentrations up, but unfortunately they didn't look any better. So she actually ended up euthanizing both of them, and they both had neuroaxonal dystrophy at necropsy. And this was kind of her big investment, right, were these two foals. So this is the reason for this research and why we need to try to figure out what the underlying genetic basis is for that disease and how to prevent it. So I kind of have this timeline in my head a little bit because I'm always very interested in the fact that vitamin E deficiency is associated really with 3 diseases, at least in horses, but they present at different ages. So the classic equine neuroaxonal dystrophy, equine degenerative myeloencephalopathy, is typically a disease in young horses. So they usually present like those, the colt and the filly do, somewhere in the 5 to 12 months of age, you start to see it all the way up to 3 years of age. Now, Dr. Johnson at New Bolton has described a subset of warm bloods that seem to be presenting at an older age, i.e. 8 to 12 years of age. And histologically, when you look at those horses at necropsy, they have the same lesions as these young horses, but could it be something different that's causing it? We don't know yet. So in my mind, kind of classic ENAD EDM are these young horses that present the way I showed you in that video. Dr. Valberg touched upon vitamin E responsive myopathy, and we'll talk about that a little, but these tend to be older horses, middle-aged horses, and then our motor neuron horses classically are older. So they're classically these older horses. That being said, we've seen some young ones, so not all horses read the textbook, but this is usually, I think of this as a long-term deficiency, and at least the work that Dr. Divers did at Cornell shows that they need quite a lot of time to develop this disease. So Dr. Valberg talked about vitamin E deficiency and poor performance, and I just kind of want to expand on that a little bit. So this is the hind end of a quarter horse that lives in our research herd who does effectively 0 performance. He just stands around and eats, but he's not on pasture. So his vitamin E is 1.52, so anything less than 2 we consider deficient. So he's deficient, but he looks completely fine. Interestingly, when we take muscle biopsies from these horses, from that tailhead biopsy that Dr. Valberg was talking about, we can see, again, those moth-eaten fibers that she had talked about earlier in the talk when you use the mitochondrial stain. And then if you take this even to a deeper level and look with electron microscopy, you see lipofuscin. So lipofuscin is oxidized lipopigment, and this happens anywhere you have vitamin E deficiency, where you have a lot of oxidative damage, you can get this deposit. So we'll see this in the retina of horses. You can see it in muscle if you look at this level. And I think the really important piece is that you can have poor performance without necessarily having a ton of this, right? Just a little bit of that lipopigment can affect mitochondrial function. So I think of vitamin E deficiency, even if you're looking at a horse and the owner says the horse is performing great, everything is fine, I think of it as a ticking time bomb. And it's just, when is it going to push over to that edge, right? And so I do think it's worth intervening sooner rather than later. One of the things I always forget to do is to look at the retinas. So vitamin E deficiency will also manifest in the retina, and the retina being the reflection of the central nervous system. And what you'll see in many of the cases is at the tapetal non-tapetal junction. So remember, this kind of light to dark junction here is a tapetal non-tapetal junction, and then this beautiful pink part is the optic disc. You'll get that same lipofuscin that's seen in the muscle in the retina. And so it looks like it's crumbling. That's how I explain it to vet students, right? It looks like the tapetal non-tapetal junction is crumbling. And when you see that, you kind of almost don't have to wait for your vitamin E level to come back. Like, you know that that horse has been deficient at some point in its life. It's kind of like a calling card for vitamin E deficiency. Now, if the retina is completely normal, it doesn't rule it out. But if you see this, this is a cross-species vitamin E deficiency, this is what it does. So it's really good to incorporate a retinal exam into some of these cases. So I tried to put take-home points in through this talk, just to kind of have the important things that I think we should walk away from. So hopefully I've convinced you that adequate vitamin E is required for neuromuscular health, and this is with or without a genetic predisposition to some of those diseases we talked about, right? Every single horse, it is really important. And they're getting it from pasture. So why are we talking about it all the time? Because we're not keeping our horses on pasture. It's so nice to come to Ocala and see green grass, but I need to see more horses out on the green grass more often. So let's talk about how we take samples and collect it. So this is what horses should be doing. And that actually, those pictures are from California because I committed some of our budget to irrigating pasture because I'm like, if I talk about this, I can't have horses on a dry lot because the rest of our facility looks like this. Okay, and this is honestly the West Coast. And these foals are growing up in that environment. And that foal that you have on the right there actually went on to develop ENAD EDM. It was a warm blood colt. And the owner gave me this picture and she said to me, I just don't understand. Look how healthy and great he looked when he was young. I don't understand how this happened. And I show this picture to vet students and I say, what's wrong with this foal? And they were looking, they're like, oh, you know, is he atrophy? I'm like, no. Look at the background, right? This foal is growing up in a dirt lot. That is what's wrong. And that is setting the scene for the disease he developed. So my take home point number 2, because I always get asked this, well, how much? Is like 2 hours a day okay? No, it's not. The studies have shown that they have to be on green grass. So the greener it is, the more vitamin E it has, for at least 12 hours a day for at least 6 months out of the year to have adequate vitamin E stores. So I don't know many performance horses that are living this life. I think we really need to kind of assess what we're doing as far as turnout goes, but this is a hard thing for performance horses to check that box on. So that's where we can come in and we can supplement them. But first, how do we assess it? So there was actually, vitamin E celebrated its 100th birthday a few years ago. And I got to go to Belgium with all the vitamin E dorks, mostly from the human field. And we talked about the fact that vitamin E had all these isoforms and the naming, and it's so confusing. And so thankfully, a paper came out from that cool meeting that said that, hey, alpha tocopherol, we can call alpha tocopherol vitamin E. So instead of saying alpha tocopherol all the time now, I can just say vitamin E because alpha tocopherol is the only isoform when it's deficient that causes disease. So from the human field, that classifies as a vitamin. So we can say vitamin E from now on. I don't have to keep tripping over alpha tocopherol, and it was a cool meeting. So how are we going to assess it? So serum is usually the sample I'm taking. So red top tube, the biggest risk of getting a falsely low vitamin E concentration is if that sample gets hemolyzed. So if you pull that serum tube and you spin it down and that serum is pink, I throw it out and I go get a new sample. That's really the biggest risk of a falsely low vitamin E concentration. It's also light sensitive, so stick it in a glove or wrap it in aluminum foil, but honestly, that's not as big of a deal breaker as the hemolysis. And then keep it refrigerated or on ice. You know, the lab is always telling me this, and I'm like, yeah, it's horse serum, right? It gets a chicken fat clot. So I just usually keep it covered, let it clot, and then spin it down and keep it cold after I spin it. So it is sensitive to light and it is sensitive to warmth. So spin it down as soon as you can. Again, keep it covered in the fridge or on ice. We were for a while measuring this in cerebrospinal fluid just to see. It's the same method. I will tell you that it correlates beautifully. If they're low in the serum, they're low in the spinal fluid. If they're normal in the serum, they're normal in the spinal fluid, whether they have disease or not. So I stopped measuring it in CSF. It was just kind of one more charge for owners, and I just measure it in the blood. And then in muscle, we were looking at measuring this too. The tough part with muscle is that vitamin E is stored in fat. So if there's any fat in that muscle sample, oftentimes you don't really get an accurate assessment. And then I get the question, because a lot of us hate, and myself included, hate working with serum. So can we measure it in plasma? And you can. There's absolutely no difference. And we did a nice study where we looked at the correlation. So you've got plasma here on the x-axis and serum on the y-axis, same horse. And when you see all the dots line up like that, that shows you that's really well correlated. So it's really well correlated, but just stay consistent. If you're going to keep rechecking something on one horse, do serum all the time or do plasma all the time. Just don't go back and forth. And then you should be fine. So this is the table I've shown for years and years now on what normal vitamin E reference ranges should be. And depending on the lab, they will say different things, right? Cornell will come back and say like 2 to 10. UC Davis will come back and say it goes up to 5. So this is usually greater than or equal to 2 is considered adequate. And I've kind of like less than 2 I'm not happy with. That's usually where I'm sticking with it. And the reason for that is that most horses that are actually grazing at that rate I showed you earlier are somewhere between 3 to 6. So that's my goal. Like my own horses, I want them to be between 3 and 6. However, I now have these stars that say HPLC only. And HPLC is high performance liquid chromatography. This is the method that vitamin E has been measured by for years in every species, including humans. And now we're starting to change methodologies. So we're going to talk about that, but this is the reference range that we're all used to, like I grew up with. we're going to be changing things a little bit. So, so before we get to that, just remember that measuring serum plasma vitamin E really is the only way to assess status and develop a supplementation plan. And I'll show you some specific examples of how having that number really helps you decide where to go with your supplementation, because there's some horses that respond beautifully and there's some that don't. So let's talk about ways to assay vitamin E. So because this is what I study, I routinely, and I live in California, and my horses don't go out on pasture. I routinely obsess about my horses' own vitamin E concentrations. So I check them once a year. I kind of do it like a Coggins. So I submitted last year my own horses' samples, and I do them sometimes in replicates just to test the lab out. So Zara is the same as Zahara. But so I sent them to Michigan State, which is where I've always sent them. And this is what I got back. I was like, wow, I'm knocking it out of the park, right? Like, it's maybe a little too high. This is kind of worrisome. And then I read this, right? So please note that this vitamin E has transitioned to a new method, LC tandem mass spec, with increased sensitivity and specificity. And then they said, please note the new reference range. So the new reference range is much higher. So it's about 3.6 or 4 to 6. So I know these guys really well, right? I work with them a lot, and I didn't know this was happening. And I'm also consulting on cases and getting values back from MSU, right, that seem to be high. So the other thing we had going on at the exact same time is I had a resident that was doing a project where we shipped over 600 serum samples from imported horses to Michigan State because I wanted to see if imported horses were deficient in vitamin E. Always wanted to see that. And we had samples from our quarantine center that were banked over the years. And we had gotten those samples back, and there were a lot that were deficient, but it wasn't as much as I expected. I was like, that's really strange. I mean, I could be completely wrong on this, but clinically I feel like we get a lot of deficient horses in there. And it turns out it's because they were using this new technique. So, so I contacted the lab, and I said, so what's going on? And they said, well, we've developed a much more sensitive technique, and we did the in-house validation on it. So they sent me this graph, which is a little bit like that correlation graph I showed you with serum and plasma, right? Where you've got some values here and some values here. So they're comparing their LC tandem mass spec to the classic high performance liquid chromatography method. And they're saying, look, it's really, really well correlated, right? So if an R squared of 1 would be perfect, right? So it's good. And I said, okay, so but I have to wrap my head around now this new reference range. Like I like know my normal values. So can you give me a formula that, right? That I can like take those numbers and make it something I know? And he was like, absolutely. And they gave me like that formula, the Y equals thing. I was like, okay, cool, I can do that in a macro. So I made a spreadsheet, and he gave me 2 methods to do it. He said, one method is to subtract 2.2, the other method is to use this formula. So I went back to my horses, and I used their 2 methods. So this was the reported result, this was a differential method, and then this is the equation method. And so it kind of, it comes out to like you subtract 2.2 and you get there, but they were still pretty high. I've never really had my horses be this high. So I was like, all right, well, how am I gonna talk to vets about this? Like, this is a lot of math, you know? And then the other problem is I had those imported horses. And when I used the formula for the imported horses, I was getting negative numbers. So anyway, so I set up a Zoom call with those guys, and I just said, this is not going to work, and it's not going to work for these reasons. And they said, well, it's a better method. I said, it might be, but I need to wrap my head around this. So when I went back to their graph, the problem with the formula are there are no horses with low values there. So what's happening at the really low end and what's happening at the really high end? It's okay that the normal horses seem to be the same, but these two ends we were kind of stuck with. So I talked to Michigan and I said, hey, how about we do a research study? I've got an undergraduate student. Why don't we redefine your reference range for you? Let's just start from scratch. Let's not do this conversion thing. It's kind of freaking me out. Let's just start from scratch. So we got 87 serum samples. We collaborated with a group in Kentucky because, of course, they have much more grass than we do. And then there's an irrigated farm in California where they maintain thoroughbreds. So the rule was the horses had to be on irrigated pasture or regular pasture if you live in Kentucky, 24/7 for at least the past 2 months. That's kind of what I wanted to define this reference range, and we got across ages. And then what we did was we actually split the samples. So we got the samples from the horses, we split half, and then we sent half to Cornell, and Cornell runs HPLC, the regular method we all have known, and then I sent half to MSU. So the results, if we look, we've got this kind of correlation again, right? So we said if this is 1, that's 100% correlation, and it's quite good, so 0.87. Again, though, I mean, look at the range here, right? We're talking, this is kind of HPLC, our near and dear over 2 is here. But look what's happening up here, right? So it's nice here, but there's something weird going on up here. And so what I did was I went in and I just picked the upper quartile, so the highest values. And then I want to show you what they look like. So you would have a horse at Michigan, this is the same horse, that would measure 9.67 on its vitamin E. Cornell, it was 2.89. So, there isn't really a consistent pattern other than Michigan's always higher. So the correlation falls apart when you get these high values. And I kind of showed this data to the lab and I said, hey, this is really worrisome, right? I mean, if I get a value back and it's 9, but it's really 2.8, I'm going to decrease the amount of supplementation I'm giving the horse, but I shouldn't be because I'm perfect, right? So I'm a little stuck. And then I did the same thing where I looked at the lower quartile of horses, and this was a little bit better, but I mean, it still wasn't great, right? So, you kind of have 3.3, 2.3. You can't subtract the 2.2 anymore. So when you get to the ends of this, it falls apart a little bit. So this is like keeping me up at night. So I was like, okay, what's right? Like, what's the right answer, right? And so what I asked them to do is, could you take a certified standard, i.e. you buy it off of some chemical company, you know exactly how much vitamin E is in that, split it, and let's run it at both labs, right? Let's just see what we get. So they did that. So there were replicates. Certified value was either 1.5, 3, 6, or 15. He started to name them after Happy Days characters in here, and then we had to get a little more extensive. So I'm sure Cornell was like, what? Like, these horses are, maybe they're not old enough to know they're all Happy Days characters, but so this is what Cornell came back with. Okay, so the actual certified value is the one column on the left. This is what Cornell came back with. And then this is what MSU came back with. And so the values are more accurate at Michigan, right? Interestingly, sometimes they're a little higher, which they had to explain to me the technique, how that could be. But they do seem to be more accurate. So I have subsequently set up a call with Michigan and then Dr. Moret Traber, who's kind of the guru of human vitamin E research, just to talk about the methods a little bit, because the thought is that it should be agreeing. We should have the same reference range, but we're not sure right now. So I don't have the full answer for you yet, but here's my take-home point for this one. If you just have to pick a lab right now, right? Pick a lab. So if you want to stick with the greater than 2 to 6 reference range, HPLC, and I'll show you, I have a table of which labs are running that. Pretty much any lab at Michigan right now is running that. If you want to use this new reference range and you like the certified values and you're okay adjusting it in your head, stick with MSU, but don't go back and forth. Okay, because if you submit a sample on a horse to Michigan and you get a value back and you start to supplement it and then you recheck it and submit it to Cornell, you cannot convert it. So these are the labs right now, and this is what they're running. And then I put in blue the reference range that we defined with those horses. That'll get updated to the report. And importantly, there is no formula to convert these values. So I tried, trust me, I did like so much math, but you really can't convert them. When you get to the ends, it just doesn't hold up. So pick a lab, stick with a lab. And the only warning I have, though, is I think a lot of these labs are all going to move to LC tandem mass spec. And so this may be something we see that Michigan's the first one because it is more sensitive. The other cool thing about that technique is you get vitamin A at the same time. Because you're measuring it on there, you can get a vitamin A peak. So we were actually able to measure vitamin A on all those imported horses too. So stay tuned for those results. Many of them are deficient. Just a little teaser there. Okay, so let's talk about, once you figure out how to assess the value and which lab to go to, how to actually supplement them if they need it, and is there an injectable product? So there's some points to consider, right? I think everyone's pretty well versed now on the natural versus synthetic supplements. And then there's the liquid or the water dispersible form versus a powder or pellet. And the dose is going to depend on the type, and it's also going to depend on the horse's vitamin E level. And it's also going to depend on the horse's clinical signs. So, so I showed this table at AEP a few years ago, but this is kind of my way to simplify it. And so remember, no company is going to write synthetic vitamin E on their product. It doesn't sell, right? Synthetic is not sexy. So you're going to have to kind of read the small print. And if you do, it will say DL, which does mean it's synthetic. So D is a natural, DL means it's a synthetic. So we've got the small print in there. How long does it take to raise serum concentrations? I mean, it's true. The studies, right? Look at Dr. Pagan there. The synthetic takes a really long time, and it's kind of a waste of money at this stage. Natural powder pellet takes a bit longer, but a lot of owners are happier with that, right? Whereas the water dispersible is quite fast. The cost is kind of relative to how fast their levels go up. And then I have a level of owner annoyance. Because despite the fact, right, that the water mistalized, the liquid dispersible vitamin E is the best, owners don't like liquid supplements, right? And so they're always like, when can I get my horse off of it? I'm like, hey, I just fixed it. But so just keep that in mind too. And a lot of owners are getting better about it. And with the pumps and things, it's getting easier. But I have had that with a lot of discussions is, we can't quote unquote put it in a smart pack. And then I will say that for spinal fluid, the study that we did in collaboration with Dr. Valberg and Dr. Brown, who was a resident at the time, really the only, and it wasn't significant, but the only increase we got in spinal fluid vitamin E concentrations was actually, this was a combination where we had the water dispersible formulation in combination with acetate. So really the water dispersible, that liquid form, if you want to get levels up in the spinal fluid, is the way to go. But what I want to really drive home today are individual differences. So that same study that we did, these were 2 horses that received the liquid product at 5,000 units per horse per day. They were deficient when they started, so this is kind of less than 2 here. They were both pretty deficient. Look how beautifully this horse responded. I mean, this horse was like a winner. As far as its level going up, it about doubled as expected. Whereas this horse hardly got above 2. Despite the same dose. So there's very, very pronounced individual differences, and this happens, so this is the natural powder pellet, happens here too. So you have some horses that respond really well, and some horses that don't. And so this is something I put together for AEP proceedings 2 years ago, but this is a little bit the way I think about this with these horses. You'll notice the first step is a red top tube. So get a baseline, vitamin E. I get a lot of emails that are like, hey, the horse is at this. And I was like, well, what was it to start? Well, we didn't measure a baseline. It's really hard to know where to go if you don't know how the horse responded. So pull a baseline blood vitamin E, send it to your favorite lab of choice, use the appropriate reference range. And then if the horse has no neuromuscular disease, but comes back deficient, you've got 2 choices. If you have an impatient owner, you could start them right away on the liquid vitamin E. Or you can actually put them on the natural powder pellet and know that's going to take about 8 to 10 weeks to get their levels up. If they, however, and then in this case, these cases I would test again, so then I'd wait a while. I would test about 2 to 3 months. And then if they're in that 3 to 9, I'm pretty happy. If they're greater than 10, we'll kind of talk about risks of oversupplementation, but I might decrease the dose. And then if they're low, I usually increase the dose and then reassess. If they have neuromuscular disease, those horses go on liquid vitamin E. I'm not going to wait 8 to 10 weeks. They need it, and they need it quickly. And I would say poor performance would be horses I would put right on the liquid vitamin E, and then I would recheck them. If you have horses that don't have any neuromuscular disease and are adequate, you simply monitor them. And now we've been getting, unfortunately, kind of more and more horses that this is the case, where they're doing everything right. They put them on the liquid vitamin E, they waited the time, they rechecked it, they're still deficient. They increased the dose, they're still deficient. And so these horses, I wonder if they've got an absorption problem, right? So vitamin E is fat soluble, it has to get absorbed along with fat soluble foods. So in these cases, additional diagnostics or some sort of malabsorption might be going on, and that's something worth looking into. So that's what I consult with on those cases. But as Dr. Valberg showed with the Belgian, this is a Percheron that we had that I'll show you the case. I mean, it makes quite a difference. Like, we didn't change anything else on this horse. It was definitely not in work, and nutrition stayed the same other than adding this water dispersible vitamin E in. I mean, it's tremendous what it can do. So then I get the question about those horses that if they don't respond to oral, do we have an injectable product? So Dr. Callum Donnelly was doing his PhD in a lab, and I said, well, why don't we try this? So Stewart Products had an injectable vitamin E that they used in cattle. And I said, okay, well, there's 2 products. Let's just try this and see how this goes. I was a little terrified to inject this, quite honestly. So it did an amazing job at increasing blood concentration. So take a look at the y-axis here. So the red line is at 2. This is before anybody got injected. Okay, we've got a group that is orange is sentinel, meaning they didn't get anything. The blue are the oral, they received the oral product, and then we had these 2 injectable products. This one injectable product got their levels up to almost 20 in 24 hours, and they stayed quite high. It's pretty pronounced, so that was amazing. And then we also did spinal taps on these horses. This is, the red line here is normal concentration in the spinal fluid, and I mean, it went way up with that injectable product. So that's crazy. However, so is this. So that was one of our horses. This was the other one of our horses. And so I guess cattle get this, but nobody gets as upset. And actually one of these, this particular horse, this was so bad as far as a granuloma that my husband went in and cut it out for me. He's a surgeon. And it was an awful granuloma. So, and I gave it in the pectoral region because I was terrified of this. And I gave it sub-Q. So don't recommend this product. I don't think in any of our sport horses that's going to go well. And then one of the other things I wanted to touch upon is I always get the question, what about EC? Right? What about injectable EC? We give it to foals, it's vitamin E selenium. So I will say that the vitamin E in EC is synthetic, meaning it doesn't really do anything for vitamin E. It's more for the selenium. But I did want to share, we presented at AAP last year a study that Dr. Madigan spearheaded. And this was part of the incident with BF Chromatic and the Chromatic Fund, where this was a horse that, due to an injectable vitamin, after winning the World Cup, actually dropped dead. And so this spurred this survey that was supported by US Equestrian and Dr. Schumacher. So we surveyed 285 veterinarians. About 40% had been in practice for over 20 years. Most of these were sport horse and then pleasure based areas and in the United States. So a little over half reported using injectable forms of vitamin E and selenium. And if you look at the numbers, about 30% are administering these more than 10 times per year. And interestingly, and of surprise to me, was that there was a significant association with newer practitioners who were actually using this more frequently than those that had been out in the field. IM administration was preferred, but it was actually still being given IV. And the most common brand was EC. Some were giving BOC, which is a bovine formulation, but most was EC. So if we look at the reactions, 1/3 of veterinarians reported reactions. Anaphylaxis was in 65% of these, and then there was injection sites and respiratory distress. Of the anaphylaxis reactions, 35% were fatal. So we're trying to give a vitamin, right? And selenium. So this kind of, like, I got this data back and I just had to have a drink. And so 1/3 of vets discuss the risks with owners. 30% never discuss it. Others have risk mitigation protocols, i.e. EPI, on the truck in case they're needed. However, nearly 90% of people that answered said they have heard of adverse reactions from colleagues in literature. So I presented this at AEP and said that, I really think we need to all get on the same page about this practice. I think EC in foals is different than EC in adult horses. And I think giving it IV should just never happen ever. But there are ways to supplement selenium orally that are much safer. So when we're talking about vitamin E, we do not have an injectable product, nor do I think we're going to be moving to one anytime soon based on some of this data. So oral products should be used. So quickly, I'm just going to touch upon some risks of vitamin E because you saw those values, right? That, especially my own horses, like they're getting high. It's interesting that MSU has this on their report. Excess vitamin E is not toxic. I actually completely disagree with that because in horses, it has been shown that it could interfere with beta carotene absorption. And the Nutritional Research Council says at a certain level it can cause coagulopathies. And there have been some anecdotal reports. People have told me that their horses get spooky on high doses of vitamin E. I don't know if that's the case or not, but I've had friends of mine that are like, I'm going to give my horse less because I'm going to get more magnesium and less vitamin E. I'm like, you do that. But in humans, there is very good evidence to show that high dose vitamin E actually interferes with vitamin K activity and leads to bleeding. So we have some horses that have bleeding issues already, and I don't think we need to be potentiating this. And so just to show you a creepy picture from a person, this is actually a young man who ended up taking high-dose vitamin E supplementation to help with hair thinning. And it led to interference with vitamin K metabolism, abnormal coag panel, and low factor IX. And this is for humans, the range is 5 to 18 mg per liter. So this gentleman's value wasn't that high, but it was high enough that it led to this oral bleeding, and then he actually had black stools. He was taking 2 times the recommended dose from Costco. So I do think this is something we need to look at, and we actually were fortunate enough to get funding from the Foundation for the Horse. So we're starting this trial now this May. So we have 16 geldings, 8 are going to get a high dose, and for me that's 10,000 units per horse, which I know some people give as a starting dose, but I think in healthy horses that's a pretty high dose, and then 8 will get a placebo, and we're going to look at all the things involved in vitamin K metabolism. So stay tuned on this, because if it does end up being that a high dose is going to potentiate bleeding, we need to be really careful about what we're doing, and we shouldn't overdo it. And I will also let you know if the horses get more spooky that are on it. So I want to wrap up with some case examples. And so the first horse I want to show you is Liberty. So Liberty was, when he was donated to us, he was a 12-year-old Percheron gelding. He actually came in for euthanasia. And the owner said, can you use him for teaching? He can't back up to the hitch anymore. He's a driving horse. And so they dropped him off, and he's in pretty poor condition. They also couldn't pick his feet up anymore. The farrier couldn't pick his feet up. And one of the things we noticed was they thought that he had had shivers. And so I said, okay, well, let's back this horse up and see what he does. And you could see tremors in his tail. And he came back, but he kind of almost sits underneath himself. And then he gets very, very non-compliant. For a draft horse. You could get a few steps and that was about it. The other thing that he wouldn't do is he really wouldn't pick his feet up. If you asked him to pick even his front feet up, he would just get very, very stressed and very upset, and I could see how the farrier couldn't get anything done on him. So his vitamin E concentration was 2 in the serum, right? So he's kind of at the low end of our reference range, but he's normal. But we suspected, based on his atrophy and his gait and everything, that he might have something going on. So went ahead and took a tailhead muscle biopsy and sent it to Dr. Valberg. And sure enough, he was diagnosed with this vitamin E responsive myopathy. So it was pretty nice as far as diagnostics go. So what we did was we put him on 10 units per kilo of that natural, so the liquid vitamin E, right, because he has neuromuscular disease, for 8 weeks. I kind of already showed you the after picture, but pretty impressive change in this guy. And we were able to actually pick his feet up, which were covered in maggots because no one had been able to do his feet. So he ended up getting his feet done, looking amazing. And now, of course, everybody was in love with him. And so I'd get videos all the time of him now fat and running around and looking really good. And so I said, okay, well, this is great. We got his levels back. Let's recheck his vitamin E. So we rechecked him and he was at 8. And this is on the HPLC, right? The old methods. That's pretty high. And I was like, oh, I don't like that. I don't know about the whole vitamin K thing. I haven't done that study yet. Why don't we decrease the dose? So we decreased his dose. And within 1 week, that horse was trembling again and couldn't pick his feet up. So for some reason, he needs to have a serum vitamin E concentration of 8 for him to be okay. And I need to stop treating the number and treat this horse. But this was such a good learning experience for me that I can't be just focused on a number, right? I have to be focused on the number for that horse. And the cool thing is that we have him whole genome sequenced, and we're going to look at, these are all the genes involved in vitamin E transport, and does he have something that's affected that he can't get vitamin E into his muscle, right? So he needs a higher dose in order to saturate it and get it into his muscle. The other piece of this story was that I had to call the owner back and tell her horse was alive, right? Because she donated him to be euthanized. I didn't want to call her until I knew what was going to happen. So I had to tell her horse was alive, her horse was fixed, and my whole team loved the horse and wanted to keep it. And she was absolutely lovely. She said, I would love for that horse to be an ambassador, for you to talk about this. And by the way, should I check my other percherons? And I said, yes. And it turned out they were all deficient. And so she started supplementing them. So Liberty, actually, we would bring him out at Davis for all sorts of educational events. We had his before and after picture, and he was kind of our poster child for this. But he really taught me this take-home point is that vitamin E supplementation plans really have to be personalized to the patient. You just can't do this on a herd basis. It doesn't work. It's too inter-individual. And in people, it's the same way. Like we all have genetic polymorphisms that are going to make us have different amounts of vitamin E we need. Just like I need 3 ibuprofen, my husband could take 1, right? There's the differences in what you can process, and vitamin E is a good example of this. So I have these last cases that I want some audience participation in. So this is a 3-month-old pregnant mare, neurologically normal. Her baseline serum vitamin E is 0.95. This is where she lives. What would you guys like to do? And you can yell it out. Move her to Kentucky for the win in the front. Yes. I would love to move all of California horses to Kentucky, including my own. Say it. Take a sit. Well, you did. It's 0.95. You're so smart. You already did that. And you sent it to, it's HPLC. So yeah. If you got a 0.95 from Michigan, be really afraid because that's like a negative value. So you guys want to supplement her, I'm assuming, right? Who wants to use the liquid product? Okay, who wants to use the natural powder pellet? Who wants to use synthetic? Okay. So she's 3 months pregnant. So you actually could do both. You guys are both right. You could start her on the liquid. I would put her on, everybody's like, oh, 10,000 units. I'm like, oh, God. I would just put her on 3,000 units and kind of see where she is. You could do 3,000 to 5,000. But because she's only 3 months pregnant, you could put her on the natural powder pellet, right? Knowing it's going to take 8 to 10 weeks, but that's okay. So your goal for her is, yes, we want to take care of her, but she's pregnant. So we really want to make sure that foal is going to be okay. And now vitamin E is not transported across the placenta. So the foals get the vitamin E from colostrum. So the biggest thing you need to do in a pregnant mare is get their vitamin E levels up before they foal so you can concentrate it in the colostrum. That is like the biggest thing. So supplementing mare isn't going to help the foal in utero. It's going to help the foal after it's born. And that brings up the question about failure of passive transfer. Do we need to be looking at those foals, right, that didn't get enough colostrum? So the last 3 months of the gestation are the most important for the foal. So if you have a big breeding farm and they're like, I can't do liquid supplementation on 100 mares for 9 months, you know what I mean? I'm like, okay, let's focus on the mares that are about to foal and let's supplement them and get that ready for the foal. Okay, this one is a 3-day-old warm blood Connemara filly. The dam had no access to pasture during gestation, received no supplementation. Her vitamin E is 0.86. So we'll definitely supplement her, but what do you want to do for the kid? Yep, and what do you want to give the foal? Which product? So for me, the risk of that neuroxonal dystrophy, that early onset disease, is so high, I put these foals on liquid. And they know that they need it. We actually have foals at the research center that will put their head through the grate. And we can just give it to them. So foals, I think, are really high risk. So if you have a deficient foal, I'd be putting them on liquid. And I know once a day is really hard for a lot of big breeding management organizations, but I would say it's so, so, so important. And if that farm has any history of ataxia or anything in any of their young horses, it's all the more reason. Now, if you can take that farm, pick it up, and move it to Kentucky or move it to Ocala and put those horses on pasture, that might be the most cost-effective thing. Like, I have had owners say to me, well, I can't afford to do it. I'm like, then irrigate, right? Like, these are the solutions I'm giving you. These are the options you have. You're either doing this on every horse that's high risk every day, or you're irrigating. And so I think that's really important. So for breeding farms, really targeting vitamin E, especially for the pregnant mares, last 3 months of gestation, first month of pregnancy, are kind of important. And I have first month of pregnancy here because in people, there's some association of infertility or losing effectively an embryo with vitamin E deficiency. So I do think someone from the repro end too, if you've got a mare that you can't get bred, this couldn't be a bad thing to check. Neonatal foals and then yearlings and 2-year-olds are really important. So just to wrap up, I hope I've convinced you, if you didn't already think before, that vitamin E is really important. Please, please, please always get a baseline vitamin E level. I know owners love to supplement. I understand that, but I kind of say to them, I'm going to be wasting your money not supplementing correctly unless we take a baseline vitamin E level. And then please consider changes in the lab methods now. My apologies, but this is what's happening. And then assess individual vitamin E concentrations. It's the only way to assess the effect. We are not going to use injectable vitamin E products in horses, definitely not adults. And then stay tuned because I'm really worried that we're getting levels really high. And so if there is something going on with vitamin K, if you do have a horse that's a bleeder, this might be something to just kind of keep in the back of your mind. So there may be risks to this. There definitely are in people, and we should kind of pay attention to that. So with that, a lot of acknowledgements on this slide. My students here in the lab do a ton of this work. And then again, a big thanks to KER for the invitation to speak. And with that, I'm happy to answer any questions. Thank you, guys. Yes.
Hi.
Hi.
Okay, quick question.
Yes.
So we know that if the horses are out on pasture, their vitamin E is fine, and especially if we're given a little supplement pellet to, balance out their copper, manganese, and zinc and all that other nice stuff, we're already helping that out. So when the mare is coming in to foal, in the last 2 weeks, usually they don't have so much access to such good grass because you're trying to keep them closer to where they're going to foal, and you're trying to get their immune system up.
Right.
Usually, so how quickly would a horse go into a vitamin E deficiency?
No, it's a great question.
Yeah.
So those horses out on pasture, I would still probably go through and maybe just check them once in a while because I have had like different degrees of pasture. And this is definitely not my specialty is grass types, but there's certain type of soils where you can actually get more deficient vitamin E. So I'd still check them, but it's a great question. So usually if they've been on that, they have enough stores to get through like 6 months. Right? Because that's a whole wintering thing. If you think about it, right? Horses' natural environment, they're usually on fresh pasture for about 6 months, and that gives them enough vitamin E stored in the adipose, so fat, and stored in the liver to get them through. So it'd be a good thing to maybe just check, but I would go on the hopeful assumption that if it was green grass, she should be okay. Yeah, great question. Thanks.
Carrie. Hi.
Hi.
Hello.
Hi.
Lovely presentation as always. So I have an interesting observation. I've had 3 horses that have not shed out in the spring. I had a client that We did everything. They were older. I was convinced they were PPID. She then called me back the third year and she's like, I fixed it. And I was like, well, what did you do? And she's like, well, I supplemented vitamin E. And I was like, yeah, whatever. I didn't think anything of it. And then I had a personal friend whose horse, when it was in Colorado, had a serum vitamin E of 5.5. She moved to Iowa and the horse didn't shed. And we got to early May and it hadn't shed. And he was, probably like 11. So she ran a PPID, test on it. It was normal. And I said, well, okay, will you retest its vitamin E? So she retested the vitamin E and it was down at like 3.2. And we were like, well, this is normal. But from conversations I'd had with you, I was like, on a whim, I was like, let's just supplement vitamin E. So we put it on some vitamin E and within 10 days it shed out. Do you have any other, is that purely anecdotal?
No.
Am I making this up?
No, it's not at all. I've had the same thing. My friend who's a vet called me. She said, my horse isn't shedding out. Should I put on vitamin E? I'm like, I don't know. Same thing, try it. I was like, let's check everything else, right? I kind of went through everything else with her. But there's if you think about it though, right? Think about the deficient horses and how awful their hair coat looks.
Right.
Right? So I do think there is something to it, but I don't know the mechanism. I don't know, Joe, if you've got any additional stuff on that one. Yeah.
But it was interesting because to your point, it was normal at 3.2.
Yes.
But because we had previous blood work, we knew that when its coat was great, it had been like 5.5.
Yeah, that horse wanted to be 5.5. That's my if I ever leave university life and like make a company, right? It'll be like, what's your horse's ideal vitamin E level? And and then you can just kind of stay at that, but I'm not going to do that. Yes.
Okay, so I was hoping you could do me a favor and call up Michigan State because I'm looking at my results that were done 317 with the result of 4 and still with the new method because it's got the little star, but then it still has the old reference range.
Oh, the one that was on my report I showed you?
Yeah.
Yeah.
So can you get them to update that?
I can, but we haven't put together the whole, I'm showing you like hot off the press, but we will.
Okay,
Yeah.
thank you.
I promise you. Yes.
I won't bother you about selenium this time, but so one of my questions, like these horses that appear to need elevated vitamin E, that was all done on the HPLC. It looked like that assay wasn't as accurate. So are you worried, or like have you tried maybe to retest, say, Liberty on the LCMSMS?
It is a great question. So I am worried for a few reasons. Number one, if you look at human medicine, when they have compared their HPLC to their LC tandem mass spec, the reference range stayed the same. It didn't change. And so that's why that Dr. Traber, who's like the queen of vitamin E, I've asked her to talk to this lab a little bit about methods because I don't know enough about LC mass spec to help troubleshoot that. The other thing is we had done a study with another lab at Davis where we did LC tandem mass spec. We measured vitamin E and the reference range was the same as the HPLC. So I don't know exactly what's happening there, and I don't know if it's going to be a little bit of a moving target for a while. But I do believe their standards. They're really nice. The only thing is when they ran their standards, and this is me listening to these two very smart people talk about LC mass spec, like I don't know what's going on right now, but they said the standards were in stripped samples. So, and the background wasn't horse serum. So it might be that because we're not using horse serum, right, we're getting that difference. So they're going to redo that. So again, this may be a moving target, and I don't mean to confuse everybody, but you guys are getting results back, and I want you to know. Yeah.
One more unrelated, vitamin E related question. So I wondered, you talked about the risk maybe of bleeding. Do you have any concern about vitamin E supplementation and the association with EIPH risk?
Anecdotally, we have had some horses come in with epistaxis, not from EIPH, but just bleeding at rest that we've done full things on. We can't find anything wrong with them other than their coag's a little bit off, and they've had high levels of vitamin E, like up in the 20 to 30 is their blood concentration. We've stopped it, it's gone away, but that's why I want to do an actual study. Yeah, in people, it's a pretty big deal. Like if you go in for surgery as a human, they will tell you to stop all vitamin E supplements at least 2 weeks before surgery. So it's a pretty big deal in people, and we're taking these horses to colic surgery, and right? So yeah, something to think about. No thanks.
You made a statement about serum and plasma being the same. Is that statement true depending on the new method? And also the question on plasma, does anticoagulant matter?
Great question. So I haven't done the serum versus plasma yet with Michigan's new method. So that was just using HPLC. I think the substrate seems to be pretty good. I've run it, so the ones that I did were EDTA plasma tubes that I compared. but heparin should be the same. I think the biggest thing you'll see is because you've got the anticoagulant, it might dilute the value down a tiny bit, but in general, it's pretty much the same. So I just kind of stay consistent, like pick a tube, pick a lab, stay in that lane until something forces you to change, right? Yeah, thanks.
Hi,
Hi.
thank you. Great talk.
Thanks.
Are you running concentrations in neonates? And if so, what are you using as a reference range?
So I'm not doing it as a study per se. I know, Cornell still has kind of their reference range based on age on there. Typically, the neonates, if they get enough colostrum, their value should be the same as the mares. That's kind of in this a few studies we've done, that's what we have found. And then the other piece to that is if you look at a lot of the older literature where they did do age-based groups, yearlings and 2-year-olds tend to be a little bit lower anyway, even if they're healthy. And that data set we just got back from those 85 healthy horses, I have yearlings and 2-year-olds in there. And when I looked at them, they were the lower ones. The adult horses were higher. So I do think the younger horses tend to be a little bit lower. And then if they're at risk for any of these diseases, I kind of want to bump them up. But naturally, they're a little lower, yep.
Thank you very much for an excellent presentation.
Like, who's on first?
I just have a really brief question. What was the dose that you gave the neonatal foal?
So those little foals, so I give 10 units per kilo. So if it's a 50-kilo foal, right, it's getting 500 units. And then the tough thing with foals is as they grow, right, you're kind of like, oh, crap, I need to increase the dose. They got bigger. So just keeping an eye on that. Yeah.
Hi.
Hi.
So with Liberty, if there's an issue with the vitamin E transport, how would supplementing a higher dose actually increase the concentrations if there's an issue with the actual transport of that vitamin E?
Oh my God, that's a great question because now I get to get really dorky. So, fat-soluble vitamins, at least we know for vitamin D and vitamin A, that when they are at physiologic, meaning you're taking in the normal amount, there are active transporters in the gut that take them across. If you give super saturated amounts of those vitamins, it doesn't need a transporter anymore. It just passively flows. This is in the gut. So it's really interesting, right? Because is that sometimes with these horses, maybe there is an absorption issue, right? And if we go really high doses. So I'm thinking the same thing might be true in the muscle, that if it's a normal rate and their transporter's broken, they can't get it across. But if you flood them, right, then potentially you could have passive transport. It follows the same transport as cholesterol. So it's a really interesting dynamic. So thank you for letting me get dorky for a minute. That was awesome.
Hi. Sorry, just asking a question on behalf of over here.
Oh, thank you.
Just on behalf of Natalia over here next to me. She would like to know your opinion or thoughts on resveratrol. Sorry, I might be completely butchering that. But it's a company using grape extract, and quite a few companies in Brazil are using that as an alternative to vitamin E. Have you heard of this or know any opinions on it?
I've heard of it. I don't know of any studies that have kind of done the head-to-head, right? And I mean, there's a real big following in human medicine, right, using that. So I think it's very interesting. I guess it wouldn't replace vitamin E in my arsenal just yet, till I saw some data. And honestly, if somebody could just make, I'm looking at you, pasture in a bottle, we wouldn't need to be doing all of this because there's E, there's A, there's so many things that they're not getting. So yeah, thank you.
Hi, wonderful talk. Thank you. If you see an effect on vision in a younger horse with a vitamin E deficiency, will that usually reverse itself once you get their levels normal, or is that something that's pretty consistent through their lifetime?
No, I'm glad you brought that up. So the retinal, the lipofuscin accumulation you see, you often don't see visual changes. They seem to be okay. And they don't even get spooky, you know what I mean, from that. So I don't think clinically we see as much of it, but the lipofuscin's not reversible. So at least in the retina, in the muscle, it can be, but it's not in the retina. So you kind of supplement them. So it's nice to have a little bit of a timestamp, if you will, of right, were they vitamin E deficient at some point in their life. But yeah, visually, I haven't seen it really affect vision. Thanks.
Hi, Dr. Finno. Thank you very much for a great presentation. So this is more of a practical nutritionist question. So as a nutritionist in the field, often consulting with horse owners who don't have necessarily a muscle myopathy or other issue, but I live on Long Island and nobody has pasture there either. And that's not necessarily due to climate, it's largely due to land pressure. So we're assuming we're not getting anything from hay, even concentrates, not all horses are on recommended amounts of concentrates, and much of that vitamin E is synthetic anyway. So my own horse is on my own PPID horse is on some vitamin E, but I'm pretty conservative in my recommendations, 1,000 IUs of natural, depending on the case, but I don't feel like I'm overdoing it. Many of them do not have baseline serum or plasma measurements. Sometimes it's not practical, or sometimes even getting them to do a nutritional consult is a stretch, much less a panel of veterinary extra tests. So I guess my question is, I don't think it's reckless to recommend 1,000 IUs of natural vitamin E. It's fairly cost effective, but in the absence of some of that clinical blood information, I mean, do you think that's reasonable?
It's a great question. And go Long Island. I'm from Long Island too.
Okay.
So yeah. And you're right. There is no grass there. I think it's reasonable. I don't think it's going to hurt anything, right? It's just maybe in those horses, those per performance cases or something like that isn't enough, but it's definitely not going to hurt, right? So, and I do think it's better than not, and you're not getting it from grain, you're not getting it from hay, and you're not getting it from pasture. So it's good that they get it somewhere. But yeah, and I think that there's a lot of people that have horses that have values of 1.5 and they're doing just fine for now, and maybe forever, right? I don't think we know enough yet, but it's a good practice to I think it's safe.